let's see how it goes. So this.
Yeah, there's no back to it.
There's none? Well, online it said that there was one.
Have you seen me narrate what these before?
No, but I'm excited.
Are you?
I like going into procedures. I told Dr. Feldman that.
Yes.
Okay.
Extension wall. Yeah,
Oh, wow.
I don't want to put my color
I'll show you.
when they are not lying.
I can put a little water.
Alright, when we get home, I wanna see which one of them I want, cause I want
You
to.
can go and you can place water. You'll find it. Get the cross.
No, actually, I don't want it for that one. I want it for the little vacuum I just bought.
So I'm gonna just test this here, okay? Can you feel anything?
No.
Nothing down there? Okay. I'm gonna talk through this a little bit if that's okay. I'm just gonna show you, this is a patient that he had a previous ingrown toenail a number of months ago, and you can see where actually the line was, and for some reason it didn't take that well. So you can see the new nail growing out. There's this little line that shows that, and there still is some ingrown toenail here, and it's a little bit red at the tip. And so we're going to be doing a revision matrixectomy. Sometimes it doesn't totally take. It can be a number of reasons. One, when I pull out the nail, there can be a little piece of nail in there. Sometimes it can also be the chemical that's placed in there. So we're going to revise this. I always say a second time is a charm, but doesn't have to. Any pain there?
No.
But actually, if you look at it, the nail right here is dug in the skin, and this is actually the old nail. The new one, let me just trim this off here. So this is the old one, because it hasn't given it enough time. So that's what was irritating his skin. But the nail down here at the base, it looks like it did a good job at not growing it out. So I'm just going to take a little sliver of nail more, so this doesn't keep bothering him and coming back. So you also don't want to take too much, because you don't want it to look too skinny or narrow. So what I think happened is the area that was irritated was right here, and this is the new nail. So I think that possibly there was enough of the nail taken out, but it was just this distal part here at the tip was growing in. But to be on the safe side, it's always better to take a little bit more than it is to not do it and then have it be a problem for him, because he really doesn't like coming in here. I always have two of these little Q-tips. This is a non-medicated one. I sometimes do this just to dry out the area. And then we can see if there's any other nail stuck in there. Any pain there? Nope, it's fine.
No.
All set. So this is the chemical that we use, sodium hydroxide. I don't really know if you need to roll it around, but I tend to. I think it's just out of habit. Some people just put it in there. You want to get all the way underneath that skin. Leave it in for 30 seconds. Okay. I'm going to rinse that up with some vinegar. Thank you. Put some Amerigel on here. Just anywhere is fine.
How many of these do you do a week?
Oh. So Matrix says maybe I do 3 a week, but the ingrown toenails I do them a couple times a day usually. So this is more of a common. Now recurrent ones that come back like this,
Yeah.
I might do one or two a year. But I'm not totally sold on this coming back. I'm possibly thinking, because I think we did it, was it 6 months ago? Because what I'm thinking it was the tip part might have been wider than the base part, and so I think it was just the tip part that might have been the problem, and it may not have been an actual growing, but it was really inflamed, and to be on the safe side, I didn't want to mess with it.
Okay. Hopefully this will last.
Yeah. So you know what I'm getting at is that the distal or the distal half was dug in a little bit, but the other part didn't look like there's any nail there. You couldn't see that because it was all swollen. But when I was able to numb it up and take a look, that's what it showed. Okay.
All done, Zach.
That's it.